Welcome back to Bills in Business, where we break down the intersection of policy, innovation, and highlight the changemakers driving progress. I'm your host, Laura Davis, co-founder of USLege, and today we're heading into the world of biotech and advocacy. My guest today is a powerhouse in both politics and public health policy, Amy Whitehead, a veteran political strategist and now lobbyist working on behalf of Genmab, a global biotech company transforming the way we treat cancer using antibody-based therapeutics. Amy's work spans the halls of Congress to the legislative floors of Texas and beyond. She's worked in campaign war rooms, PAC boardrooms, and now in corporate and health policy advocacy spaces. Here's our conversation.
Well, your background, you're from Alabama originally, right? Which is how we got connected.
I think that's how we first met, was an Alabama connection.
Yep.
You gotta love it. Usually I feel like the Texans find each other in the wild. You don't hear as much of the Alabamians doing that. So I'm glad we found each other.
I know,
in
me
Texas,
too. You were one of the first people I met with because I would just ask everyone I knew when I was moving to Texas, who do you know in Texas? Because I didn't know anybody coming from DC. And everyone in Alabama was like, oh, Amy.
We know a Texan. We know someone who left us.
I know. I do actually always feel really bad because I have a few friends who are like, why didn't you pick Birmingham? And I'm like, guys, Austin is hard to not pick. It's a great city. And the capital's right here. The whole Montgomery 2-hour commute is a rough one.
It is. And that's what people do there. They don't really stay in Montgomery. And so,
because Birmingham is gorgeous. It's a beautiful city, but everyone I know lives in Birmingham who works in Montgomery.
Yeah.
So they do. It's so wild. So tell us a little bit about your story and how you got to Genmab now. But you've done a lot over the last few years.
I have, and it certainly hasn't been a ladder or a clear path in how I've worked or the roles that I've found or what I've done, but very typical kind of poli-sci major in college. It's very unoriginal when folks ask me, well, what did you major in college? Or are you a lawyer? I'm like, I'm not a lawyer. And it's boring. I majored in poli-sci. I've always been a little bit of a nerd. I always blame the West Wing. I grew up in the, the 90s and the West Wing era. And so, I was always really interested in all things political. My father was in the military. My grandmother was on our town council. So it was just always around. And it wasn't even in a tiny, tiny town. It wasn't as mysterious as it could be, to anybody who doesn't grow up around it. And so I was always interested in politics. And I started out interning for my member of Congress that represented my hometown, and he's still in Congress, actually. And
who was it?
Robert Adderholt.
Oh yeah, he is.
Yeah, he's still there. He was new when I started, and so he was sort of fresh to Congress and is still there. And so worked for his office for a number of years, and then kind of got on the campaign circuit. Worked for the College Republican National Committee, kind of right out of college. Got some good national campaign experience. And so I feel like over the years went in and out of working for elected officials versus campaigns, as I'm sure a lot of your listeners can relate to.
Yes,
you have to, you kind of have to be flexible and be willing to move back and forth to get that experience and to gain a little bit of expertise. And so did that and eventually found my way to Texas by way of, boyfriend turned husband and married. That's why I tell everyone I married a Texan. So that's how I got here. And they don't like to leave. No. And so I got to Texas and worked for the city of Houston, again, for an office holder. And then didn't really start lobbying. I started lobbying in 2000, what year was it? 2009. And really didn't know anything about government relations or what I was getting myself into. But working for the city of Houston, I had a lot of exposure on the other side of lobbyists. It surprised me that for a city, because I was from this tiny town in Alabama.
Which town?
It's called Sneed.
What's Sneed? It's south or north?
It's north of Birmingham.
Okay.
So in Alabama, we like to talk about the counties that we're from. Yes. So everything is, so it's in Blount County.
Okay.
And just north of Birmingham. And so tiny town. And so moving to Houston and working for the city council, for a city council member, it was eye-opening in so many ways.
Sure.
And it surprised me how many lobbyists can go through City Hall in our big cities in Texas. And so I kind of saw the other side of it. And I don't know if I had, maybe too much confidence, but when we moved to North Carolina for my husband's work, I was like, I could be a lobbyist. I could do that. And so really just sort of, cold called around, like pulled up, this is very old school, pulled up the list of the lobbyist registration in the state of North Carolina, and then went through and did sort of the gut check, who would I be okay lobbying for? Who would I want to get out of bed to do this for every day? So narrowed that list down, and then really just started reaching out to folks and not saying, give me a job. I need a job, anything like that, but just started, having the same, how we met here in Texas,
Very cool.
Hey, can we do lunch? Can we grab coffee? Can I learn about this? And so that's what started healthcare. I was a lobbyist for the Medical Association in the Medical Society in North Carolina. And then eventually we came back to Texas and got into the industry that I'm in now, which is still healthcare, but now on the pharmaceutical side.
How cool. You mentioned you were like healthcare was the main spot you landed. Did you contract lobby at all in that time?
I did not. I didn't contract lobby. I was very lucky in some of the relationships that I was able to make, and really was sort of shameless in saying, look, my husband he's in medicine as well. And I was like, he's a member, you have to talk to me. I really sort of pushed my way in there a little bit and said, give me a chance. And in North Carolina, they have short sessions that are just a few months, and then they have longer sessions every other year. And it was a short session. So I don't even remember what it was then, but it was, a short amount of time. And they said, okay, we'll let you come in and try it. So I was a temporary employee. They threw me in head first and said, let's see how you do. And then I ended up staying there for 5+ years. So no, I didn't contract lobby. I have dabbled in some of that over the years and in between different roles. And it's a whole different beast. I'm not sure my brain is really wired that way to manage that. I like healthcare. I like one issue. And even now I really love the work that I'm able to do that supports patients in a certain, area, in where we work in gynecologic cancers and blood cancers and all those things. I really like the focus. And I think that my experience was that I lost more of that than I wanted to as a contractor. But, really glad they're out there and we need them and we use them in all the states that we're, able to work in. But it is a different skill set.
For sure.
Yeah.
Do you think having your husband in healthcare helped you learn more or just got you more interested in it? Because I know it did that with Eric, my husband. He got way more interested in politics when we met. So
sure. Yes and no. I would say that short list I was talking about of who would I want to lobby for. I think that healthcare made that cut because I thought, well, this is part of my life now. This is going to be part of my family, and I need to care about this. And it was also in 2009. That was just before the Affordable Care Act. The Affordable Care Act was passed in March of 2010, I believe. And so this is when all the drafts were flying around. There was a senator from North Carolina who was really involved in those drafts at the national level. And so we were trying to relay that information. So there was also a need at the Medical Society to bring in kind of all hands and get folks reading these things. And so, I kind of caught the car a little bit at the time. I was like, I'm not sure that I realized by jumping into healthcare how multifaceted that was. I think it's wonderful because it gives you, from a professional development, I guess, standpoint, it gives you so many ways to build knowledge and there's so many areas you can work in. So you can move out of working for providers or working for hospitals or working for pharma or working, all sort of nonprofit. There's so many ways to stay in healthcare once you're there. And I'm sure others feel that way about like energy and education and whatever area that they're in. But I don't know if I appreciated what I was getting myself into when I said, okay, healthcare, let's do that.
Great
And
experience.
it is, and it's not really going anywhere, unfortunately. At times. But yes, I've been very happy with it, and have loved every little step along the way and the new experiences, and yeah, it's been great.
So fast forward to now, you're with Genmab, the biotech company. Can you tell us just a little bit more for our listeners who don't know about Genmab and what you do?
Yeah, so my role at Genmab is kind of go back and forth between myself and the company, but my role at Genmab is, my title is Regional Director of Government Affairs for the West, so Western U.S., and that officially, starts in Louisiana, Arkansas. I go all the way up to Illinois, and then I cover everything west of that. And so that is a lot of states. And anybody listening who does multi-state work will understand that it's really hard you can't be an expert in 25, 26 states. We have to prioritize, and we have our ways of doing that. So for me, Texas, California, Colorado are really the high points where I spend the most of my time. And then other states, just as issues might pop up that are important to us or that we're following, then we might move in and out of as we need to. And we're also members of our trade associations that help keep us informed in the states where maybe, we're not able to spend a lot of time.
Sure.
And so that's what I do at Genmab. And Genmab is a mid-sized pharmaceutical manufacturer, our biotech company. We were founded in 1999 by a small group of scientists, which is not always the case, so it's nice that we were founded by scientists who were looking for innovative ways to treat cancer, and were really inspired by our body's immune system. And so that is, wanting to use our own body's ability to fight disease to sort of tackle cancer. And so, one of the ways that works is through antibodies. And so all of Genmab's work is focused on antibody medicines because of their ability to target really specific cells or pathogens that might be cancerous or have another serious, disease connected to them. So 25 years later, Genmab really has emerged as a biotech powerhouse in a lot of ways, we like to say, because there have been many medicines who are powered by Genmab science and have been breakthroughs across some really complex cancers. And it's our goal that it keeps getting sooner and sooner in 2030 that our antibody medicines are really able to fundamentally transform people's lives that are living with cancer, again, by using that, our own immune system through antibody science.
So am I correct that Genmab's mission is to focus more on the gynecological cancers? Is that correct?
So Genmab is focused in a few areas. We actually work in blood cancer as well as gynecologic cancer. So lymphoma is a big focus area for us. But yes, gynecologic cancer is also a real primary focus for us. And that includes cervical cancer with our existing portfolio, and then also ovarian cancer and endometrial cancer, which are sort of, kind of coming down the line for us.
Why do you have that focus specifically? Are there other gaps that kind of exist, and what makes it more kind of compelling on the advocacy side?
Yeah. So a lot of the work that we do in the government affairs space at Genmab right now is in awareness building, reputation building for the company, of course, but really building relationships around awareness and with advocacy partners in the states that we work in, making sure to raise the patient voice whenever we can. And it is a timely question because September is actually Gynecologic Cancer Awareness Month. So as a company, Genmab is focused on identifying and addressing areas of a true patient need, which does include gynecologic cancer. And Unfortunately, many advanced and recurring gynecologic cancers, like I mentioned, cervical, ovarian cancer, endometrial cancer, really do lack effective treatments and have such poor prognosis. Once you hear that you're diagnosed, it can be a really terrible prognosis. So as an example, ovarian cancer is one of the leading causes of cancer deaths among women and is the deadliest gynecologic cancer. And so, investment in research and development in these areas for gynecologic cancer also remains really low. So that is a gap that Genmab is looking to fill because, as I said, we have one approved therapy, Tivdak, which treats advanced cervical cancer, and Rina-S, which is a therapy that is being investigated for ovarian and endometrial cancers right now.
Wow. So is it your role as well to kind of raise awareness of some of these cancers and the way that women can identify, what issues they may have, or specific to, the treatments and the therapies that Genmab's come up with?
Yeah, it's a great team effort across the company, I would say, to do that in sort of lifting that patient voice in everything that we do. From a government affairs standpoint and in the state capitals, that is certainly something that I spend a lot of time doing. We held an event in May for World Ovarian Cancer Day, and Chairman Ken King and Representative Carissa Richardson participated in that event. And those are just some of the examples of things that we try to do to raise awareness, but we partner with organizations. ACS CAN partnered with us on that event as well. And so, we definitely try not to go at that alone. We always want to have, the patient voice there and the advocates that really, know their stories and experiences really well. We want to also include them as part of anything that we're doing in state capitals across the country, not just in Texas, but it is a big part of what we do. And it's the fun part, I think, of what we do. And I really enjoy that aspect of my work. It's very fulfilling. And, but we definitely, try to weave that into everything we do. And we have a great patient advocacy team at Genmab as well, who connects that work with us. And also they do, work in DC and things like that too. And so we try to make it a big group effort in, raising awareness for all of these types of cancers. Because I think, what do they say, like rising tides lift all boats. If we can keep it part of the conversation, then we know that will, it will do nothing but help inform policy discussions down the road. Right now, if we're just raising awareness, and we again try to work with aligned patient groups and partners, for their, they know, they have the expertise, they have all the talking points around what are symptoms and how to get screenings and all that, they have all that information. But what we really look to do is look for ways to, make that part of the conversation in elected officials, daily interactions with the Capitol. How can we make put this front and center and make sure that those voices are being heard and that there's an understanding of, again, that need that exists, because there are gaps still, especially, like I said, in gynecologic cancer, there are some sizable gaps there. And so we just, the more we talk about it, hopefully the big picture will rise to the occasion and we'll start to fill some of those gaps.
Of course. And you have a big, territory of states you're raising awareness in.
Yeah.
Are you working at the federal level too?
I do not. No, I just stay at state. We do have we have federal folks in Genmab, but
sure,
I am not one of them.
You have a lot on your
plate,
so that's okay. That's
I can't add that right now, but yeah, we're and doing the same things, trying to do Hill briefings in DC around gynecologic cancer, and I have attended and participated in some of those wherever possible, and we've tried to even pull learnings from those types of things into the work that we're doing in the States, and just sort of the questions we get and the feedback we get. So things often inform activities in other places, and we're a small enough company that we can have lines of sight into what each side is doing for sure. But yeah, thankfully I don't do that.
Well, speaking of the states, so we've had most states have a year-round legislature, or at least annual legislature.
Mm-hmm.
In Texas, this was must have been a big year for you legislatively, because so many states were in session starting in January.
Mm-hmm.
So what were you really focused on this session, Texas and other states as well, like policy-wise?
Yeah. So again, for us, that awareness building in these gynecologic, ovarian cancer, and in the blood cancer side as well, that work really is front and center for us in many ways. Again, we work with patient advocates and professional organizations that we're members of, and policymakers to drive that awareness, and to deepen that understanding of the patient perspective. And so we invest a lot of time in that area. And policymakers are such a vital part of building this whole ecosystem. So and play a big role in ensuring patient access, and that patients have the ability to receive the treatment and the care that they need. And so, that sort of underlies all the work that we're doing at the state level and the federal level. So anything that might affect that, that access piece in one of the states that we're working in is going to be really important to us. And we, also are just trying to, we're looking to build relationships with caucuses. Texas has a women's health caucus. And so, we really tried to spend some time this year just, getting to know the staff with the Women's Health Caucus and looking at ways that, perhaps we can help spread the word around cervical cancer and ovarian cancer and the gynecologic cancer space too. And so, it's those awareness building activities and initiatives, while sometimes they're not the thing that you're going to see on the front page of the newspaper, they've been really a big part of what we have done, what we've been working on this year, and a foundation that we, again, are trying to lay to just kind of elevate that patient voice and really have a strong starting point, introducing ourselves to policymakers so that they know who Genmab is and they know what we do, so we can start having some of those bigger discussions when the time's right.
What were some of the big legislative priorities? It sounds like you had a lot of, introductions to make and kind of making them more aware, but did you have any, big bills specifically that you want to note on the session?
Yeah, I mean, again, it's just like those access pieces we follow. There's things in the budget, and there's so many parts of the state that can sort of touch our industry, and so we really are really hyper focused on anything that might affect access and affordability and for the patient, and really looking to, again, kind of just fill that gap in awareness. And so that's the priority for us. We are members of THBI here in Texas. We're members of pharma and bio. And so there are a lot of things that, again, touch our industry that we might engage with, in Texas or in other states, that are important to the patients that we work with, that are important to our business, but they vary,
And I know that some of the wins can not be as quick when there are these really dense, like, policy discussions in the budget or in health, really big omnibus bills. So what keeps you, motivated and wanting to help advocate for those?
Yeah. Personally, I feel like I touched on it a little bit of learning that, I learned that kind of getting out of bed for a certain issue was really important to motivate me. And I've learned that that I'm very happy in the healthcare space with that. And I've learned over the years that this is where I personally belong in maintaining that motivation, but especially Genmab, where I've been at Genmab for almost 2 years now, not quite. And the work that the company does and their aspiration to really change the lives of people who are living with these really complex and serious cancers. And as a woman, of a certain age, things like gynecologic cancer and ovarian cancer, all of that even probably hits closer to home than maybe it used to for me. And so it's a hard thing to talk about, but it's also a really easy thing to talk about. And so it really motivates and inspires me personally to do all of this work, you know, to fly to other states, to fly to multiple states perhaps in a week, and, you know, or be in one place on, you know, be in California on a Friday and Colorado on a Monday and then back to Texas the day after that. And so you really do have to have, you know, the goal in mind and something really inspiring. And so I'm proud that I have that at Genmab, but also just seeing, you know, being able to see, again, saying that things move quickly at the state level, you know, being able to see practical improvements in community health as we, you know, again, making these efforts to raise awareness. It might not sound like a very difficult thing to do, or it might not sound very complex, but it's like, well, when you see that the things that you are doing maybe are clicking with a patient, somebody saying, oh, well, maybe I need to go get screened for this, or I didn't realize that I wasn't being screened for ovarian cancer when I go to my gynecologist, or just little things that you hear and that you pick up along the way. To me, sharing, you know, that information sharing, that resource sharing, and just improving, you know, sort of the patient view of these cancers, and, you know, if you can kind of motivate one person to go get checked out or to ask the right questions, to me, that's a really rewarding opportunity that we have. And then, of course, just, you know, as I mentioned, there's a gap in the industry in research and development in this area. And so I'm really proud that Genmab is working to fill that gap. And, you know, on a personal note too, on the other side of our business, I mentioned that Genmab also works in blood cancer. Prior to my time at Genmab, I was very involved with the Leukemia Lymphoma Society, which is now called Blood Cancer United. They just changed their name, like, within the last couple weeks.
Okay.
And so, but I was involved with the work that they were doing for a really long time. I ran like a marathon with them back when I could still run a marathon, a really long time ago. And I did team and training. I served on their board for a while. I did their Visionaries of the Year program. And so, as many capital folks have been involved with that organization over the years. And, you know, I was already deeply involved with them locally before ever coming to Genmab. And so being able to make that connection in your personal life with your professional life is always, I feel like it's always unique. It's a little bit of a gift to be able to do that. And so that also just kind of gets me out of bed every day. I'm like, oh, this is, you know, I've finally melded all these worlds, you know, together with the things that, you know, I personally value and want to support. And then to be able to go to work and try to make a tangible difference in that space too is pretty rewarding.
And you did a blood drive the other week in your personal life.
We did, yeah. We did a blood drive. You know, blood donations are really, so September is also Blood Cancer Awareness Month.
Okay.
We get it across the board. Ovarian Cancer Awareness Month, Blood Cancer Awareness Month, Gynecologic Cancer Awareness Month. And so, yeah, September is big for us. And blood donations are incredibly important to blood cancer patients. And so, and those are the types of little things that if we can, you know, try to share that information. Thank you to Eric for donating. We really appreciate him.
Yes.
And so, those are the types of things that we just, you know, want to make sure members of our capital community are aware of and give them the opportunity to act on that if they'd like to. And, you know, we're trying to scale that across many of the states that I work in and that my colleague in the East region works in as well. Back specifically on the gynecologic cancer side and the ovarian side, you know, our government affairs team at Genmab, we have a whole women's health initiative is what we call it. And I sort of spearhead that on our team of just, you know, looking at, okay, where are the opportunities across the country and some nationally. I already said I don't work in DC, but we do try to look at where the national groups are where we can build partnerships or, you know, collaborations of all different kinds come on your podcast and talk about
Sure.
gyn-onc awareness and things like that. You know, all these little things that we hope will, snowball into just a greater, social awareness for these cancers. And we're just so happy to be able to come talk to you about it.
Yes, thank you. I'm learning a bunch.
Yeah.
And good timing for, all the state awareness months.
It is September, man. It's piled on, but
Busy month.
it is busy, but all good things. Like I said, good things to talk about.
So what are you seeing? You represent a lot of the Western states, and what are you seeing as far as like policy wise evolving in healthcare? How is that evolving right now?
Yeah, I know we had originally planned to have this conversation a few months ago, and that answer probably was a lot different then than it would be now. I think that just, again, even though I don't work in Washington, I like to start our conversations inside my company, even by saying, look, I cover Texas and California. And, those are very different places.
Yes.
And very, with different priorities, different challenges, and different ways of reacting to, some of the national trends that we're seeing. And so, I think that just the big picture of things that health policy that can trickle down from Washington are handled very differently. This is probably obvious to many of your listeners, but is handled very differently from state to state and how they approach that and what they do about that and whether they file lawsuits or whether they, jump in and implement, similarly to the federal government. And so it's different. If you've seen one state, you've seen one state. And so they do things differently. But I think a trend is I think there is more appetite than ever before that I've seen to just kind of try. Like if you have an idea, let's just try it and see if it works, or see if someone stops us, or see if we can make it, and so it's, that I think is a trend, and that is I think that occurs in healthcare. I think that occurs in all the other industries too. But I think states, I love working in state government affairs because it moves quickly. I think it's impactful, the work that we do, but it moves quickly. And so we have to pay attention to those trends and the activity going on at all this, in all the state levels. But I think everything that we might have seen federally coming out with provider cuts and impacts to Medicaid coverage, all of those things, are going to impact states all differently, but it's going to lead to more special sessions because no matter what side of the issue you fall on, if your state budget is different, is fundamentally different than it was before, passage of federal legislation, you're still going to have to, in most cases, you're going to have to go back and figure out how to rearrange that budget or to move those dollars around again, even if you're supportive of how it was done. And so that's something that I think we and others are certainly aware of and paying attention to, is just, okay, how are our state budgets changing? Or does that create a special session opportunity? And then other things come in, as we all do in Texas, when we hear special session, we're like, oh, okay, what's going to be on the call? That opens a door for all of us to potentially have more on our plate. And so we are paying attention to, to that for sure as well. But, I think that states are also, to kind of focus in on our industry, states are becoming players in incentivizing research and in biotechnology and in pharmaceuticals. I mentioned before, I can't remember if we were recording yet or not, but mentioned before being in California. And so, those are some of the activities that are causing me to travel, is to just, hear what other states are doing in that space around incentivizing research. And so, state level, there are shifts in how the state is looking at insurance coverage requirements, access, again, those are the types of things that we work on. We want to make sure that, patients are able to access the therapy that their physician, wants them to have, that their provider wants them to have. And, so everything that comes at all levels of government has the potential to affect that access piece.
Sounds like there's just a lot of change right now. And for any new company innovating, it's like throwing mud on the wall and see what sticks a little bit.
Yeah.
It sounds like in each state. But yeah, that's very cool that you cover all of those different states, because I don't know how you do it.
Yeah.
That's very
well.
impressive.
It's the federal government is certainly, or I shouldn't say federal government, but the federal level, all that activity is certainly driving states to increased activity. They have more to do because of all of the things that are happening at the federal level, and some of them are taking matters into their own hands, and that certainly affects our industry and the patients
I
we're
bet.
serving. Yeah.
So how can people who are listening and who are passionate also just about this cause kind of get involved in what you're doing, what Genmab's doing, if any big things coming up that people can get involved?
Yeah. So, Genmab's work is, we have a US website. So Genmab, it's GENMAB.com. We have LinkedIn accounts, we have X accounts. I don't think you'll find us on the others, but you can certainly see what our company in the US, what we're doing in the US if you're interested in this work. But also, I have a personal LinkedIn that anyone, can reach out to me for sure if they would like to know more about any of these spaces that we're working in, or even just the industry and the jobs and,
Shamelessly plug,
multi-state, all that kind of, because it is. I remember I didn't really have a lot of exposure to the multi-state government affairs world until I got a job that was a multi-state, not the Genmab job, but a job before, and a couple of jobs before. And, I was like, oh, okay. Like they handed, I remember my first trip, it was like, go to Nebraska and do this thing. And I was like, are they going to let me into Nebraska? Like, they're just going to let me come talk. And so, I'm always happy to share insights about this work and what we do, specifically at Genmab, but also personally, if anybody has questions or would like to chat. And, we've partnered with the KK 125 Foundation, which is Chairman King's Foundation for Ovarian Cancer Awareness. So things, maybe, a plug for them as well. And, we're hopefully nearing the end of sessions for a bit. And so, I'm not sure when this airs, but we are, the State Agency Council, which is, organization that the Governor's Commission for Women works with to raise awareness of issues and have conversations. We're working with them on a networking event around ovarian cancer awareness later this month, and just lots of things, supporting PHBI and the work that they're doing, trying to plug into some of that. So we're around, we're a little bit of everywhere. So
awesome.
Let us know.
How can people reach you personally?
To reach me personally, I think the LinkedIn is probably the best way to do. It's such I don't work in DC, but that's such a DC answer. Amy Whited. And I think that's probably the best way. But, if they know how to find you, they know how to find me too. So
that sounds good. Yeah, we'll be posting all that in socials. But thank you for the very impactful work you're doing and Genmab, and appreciate you coming on the show. So
of course, thanks for having me.
Yes.